Hello, my name is Cher, and I'm going to be your nurse today. Can you tell me your name and date of birth?
My name is Shonda Thomas. My birth date is January 3rd, 1999.
Okay, great. Can you tell me what brought you in today?
I've had a headache for about 4 days, and it's getting worse.
Okay. Anything else?
Yes, along with the headache, she also had weakness on her right side. And this morning she dropped her smoothie along with her cell phone, and I noticed she was limping. And also, she started slurring her speech and started talking strange, so I brought her in today.
Okay, great. Is there any significant past medical history related to this?
Yes, she has sickle cell disease and asthma.
Okay, does she take any medications for her sickle cell disease?
Yes, she takes hydroxyurea.
Okay, and is it helpful to her?
Yes, it's been very helpful, but as a teenager, you know how it is. She forgets sometimes, and when she gets very busy.
Okay. Has she had any complications related to her sickle cell disease?
Well, she's been hospitalized several times with painful sickle cell crisis, and she also has twice she's had acute chest syndrome, but overall she's done pretty good with it.
Okay, in the past when she was hospitalized, did she ever receive any blood transfusions?
No, she has not. She's never had any blood transfusion, no.
Okay, so Dr. Smith and I are going to go ahead and do a physical assessment now. She'll start with a neuro assessment, okay? Is that okay with you?
Yes.
Okay.
Hi, I'm Dr. Smith, so I'm going to get started doing an assessment with you. Can you pass me the...
Absolutely.
Okay, so what we're going to start with first is for you to look at the wall behind me while I check your pupils, okay?
Okay.
Okay, thank you, thank you. Okay. Next, I'm going to have you grip my hands, okay? And squeeze as hard as you can. All right, now I'm going to push back. I want you to push against my hands. Okay, and then I want to push towards me. I want you to pull away from me. All right, I'm going to do the same thing with your legs down here. I want you to push against my hands. Okay, now I want you to pull against my hands. Okay, all right.
All right, Sarah, I'm going to go ahead and listen to your heart and lungs with the doctor as well. Just take slow, normal breaths. Thank you. Okay, good. In and out, nice and slow. Good job. And again. Excellent. Good. And one more time. All
I'm
right.
going to check the back as well. There's some breaths in for me as well. Nice deep breath.
Okay.
Okay. So tell me about these headaches that you're having. Can you tell me a little more how to describe them?
I woke up a few days ago, and I had a headache and tingling on my right side.
Okay.
I get headaches, so I thought it would just go away.
Right.
I took ibuprofen and went to school. It didn't seem to relieve it. It seems like it's just getting worse and worse.
Okay. So on a scale from 0 to 10, with 10 being the worst pain imaginable, how would you rate your pain today?
It's about an 8.
An 8? Okay. And what does the headaches feel like?
It's aching, sometimes stabbing.
Okay. And are the headaches constant, like all day long, or do they come and go off and on?
They're constant.
They're constant? Okay. So Cher, what do you think we should do for Sarah?
Can we give Sarah a thrombolytic?
Well, thrombolytics are not really indicated in this case because they haven't been tested in sickle cell patients. And plus, the cause of stroke in sickle cell patients is different. With sickle cell patients, the sickle cell clumps together in the arteries causing ischemia. And if it happens in the intracranial nerves, intracranial arteries, it can cause a stroke.
Oh, okay. So what do you think that we can do for her then?
Well, I think we should do an exchange transfusion. That way we can decrease the amount of sickle cells in her blood and increase oxygenation in her blood.
Okay.
But I think we should call hematology to get the input on this as well. Since the transfusion is very complicated and we need to help to do exchange transfusion.
Okay, great. Thanks.
So we have the results of your CAT scan, and it shows that you are having a stroke. So we're going to do an exchange transfusion, and what an exchange transfusion does is reduce the amount of sickle cells in your blood and replace it with donor blood that's not sickled, and that increases oxygenation in your blood.
Okay.
I know it sounds scary, but do you have any questions at this time? We're going to take good care of you. Do you have any questions about the procedure?
Not really.
Okay, so I'm going to go ahead and gather the equipment so we can get started today, okay? All right,
Okay.
thank you.